In this video, we're going to talk about the risks of HRT. For most women, the biggest concern about HRT is the breast cancer risk. So let's talk about that. Firstly, breast cancer is really common. It's the second most common cause of female deaths. 90% of breast cancers are due to what we call population risk, which is contributed to by both modifiable and non-modifiable risk factors. Only 10% come from an inherited gene mutation. 80% of all breast cancers affect women over the age of 50. So when we give estrogen and progesterone together in HRT, which is most of the time, it does increase your breast cancer risk. However, that increased risk is much smaller than many people would think, and it only affects those over the age of 50. So 23 out of 1,000 otherwise fit and healthy 50 to 59-year-old women will just get a breast cancer. If you gave those same 1,000 otherwise fit and healthy 50-year-old women combined HRT, a further 4 in 1,000 would develop a breast cancer. That's a 0.4% increase in risk, so very small. Comparison with other risk factors is helpful in putting those stats into proportion. So 25% of breast cancers are linked to lifestyle issues, whilst only 2% are linked to HRT. Drinking 2 units of alcohol daily increases your risk far more than HRT. So from 23 in 1,000 to 28. Body mass index of over 30 more than doubles the risk. Drinking 2 units of alcohol daily increases your risk much more than HRT. A body mass index of 30 or more actually more than doubles the risk. So from the baseline of 23 in 1,000 to 47 in 1,000. Interestingly, HRT only containing estrogen actually reduces the risk, as does moderate weekly exercise. Whilst estrogen-only HRT would reduce breast cancer risk, it significantly increases endometrial cancer risk, thus is only given to women who don't have a uterus. Sequential combined HRT with a short duration of progesterone for longer than 5 years has been shown to slightly increase endometrial cancer risk. In order to manage this, progesterone must be given proportional to the estrogen dose. So higher dose estrogen will require higher dose progesterone to balance it and to manage endometrial protection. The other set of risks that we talk about is about blood clots and strokes. HRT is associated with an increased risk of blood clots and strokes. This is dependent on the type of hormones used. There is a small risk of blood clots associated with oral estrogen tablets only. Oral estrogen is absorbed through the liver. The liver affects the way we clot our blood, causing it to be more sticky and thus increasing the chance of blood clots. To put the risk in context, if we took 10,000 otherwise fit and healthy 50-year-old women, 6 would have a blood clot. This would double to 12 in 10,000 using oral estrogen HRT. This does not occur with estrogen used through the skin as a patch gel or spray. Therefore, oral estrogen should be avoided in those who are already at higher risk of blood clots. The choice of progesterone also has a bearing on clot risk. Old-fashioned progesterones, such as the ones that are in combined oral HRT or the progesterone in combined patch HRT, has been shown to have a higher risk than the more modern micronized progesterones, which are more body similar and have been shown to have less clot risk. Nowadays, transdermal estrogen with micronized progesterone has become the first choice of HRT as it's generally considered the safest combination.